Good afternoon, everyone, and thank you for joining our webinar, Health Impact Assessments for Community Development Corporations, Exploring Best Practices and Opportunities. It is great to be here with you all today, albeit virtually. My name is Brittany Chen, and I'm with Health Resources in Action, and we will be doing introductions of all our speakers in just a moment, but I wanted to go over a few logistical items. Due to the large number of participants, we will be keeping all of the phone lines on mute, but if at any point you have a question, please feel free to submit it via the question box on your dashboard, or you can raise your hand and we will be answering questions as they come. And we will also answer any questions submitted through the question box at the end of the presentation. So without further ado, let's start our webinar with introductions.
So hi, I'm Allyson Auerbach. I'm a Community Health Associate with Health Resources in Action. And Health Resources in Action is a national nonprofit public health and medical research organization located in Boston. We're dedicated to promoting healthy communities through partnerships with community and philanthropic organizations as well.
And my name is Brittany Chen, and I'm with Health Resources in Action, and I'm a Senior Program Manager, and I've been with the organization for about 7 years.
And I'm Ben Wood, and I'm the Healthy Community Design Coordinator for the Massachusetts Department of Public Health, and I'm in the Division of Prevention and Wellness.
Great, and just so we can get a sense of who here is on the line, I'm going to put up a poll question. So if you would take a moment to answer this question, what type of agency do you represent? And we'll have a sense of who's here in the audience right now. Okay, just letting a few more people have a chance to vote. Great, thank you so much for participating. So right now it looks as though we have primarily people from nonprofit organizations and community development corporations. Are you able to see that? Great. And so, which is great because that is the audience that we are hoping to reach today. So right now I'm going to pass this over to Ben, and he can give us a little context for the webinar.
Okay, thanks, Brittany. So as Brittany said, I'm just going to provide a real brief background on why we put this webinar together. It is supported by a Centers for Disease Control grant, which is our Fostering Healthy Community Design through Health Impact Assessment grant that we have at the Massachusetts Department of Public Health. And the grant's focus is on making the connection between the built environment and health. And when we say built environment, we mean topics such as land use and housing and transportation, and sort of big topic areas such as those. And we do that by actually doing health impact assessment, by training others in HIA and supporting others doing HIA, and also some general healthy community design capacity building initiatives. And we do it, all those different things, with many different partners. And I just wanted to name a few. So my bureau at the department is the Bureau of Community Health and Prevention. And we work closely with our Bureau of Environmental Health on health impact assessment related initiatives. And outside of the department, I just wanted to name a couple of important partners, the Metropolitan Area Planning Council and Health Resources in Action, who we have done health impact assessments with in the past and currently. And in addition to actually doing HIA, we work with them on a variety of different training and capacity building initiatives. So one of the major lessons we've learned over the past couple of years as this grant has unfolded is the importance of community development, or rather I should say the importance of us knowing more about how community development and community health interact. So that's a major reason for doing this webinar. It gives community development corporations and others who do that type of development work locally in the community or support that type of work, a background in health impact assessment, and to spur some thought on your part so that you have a better understanding of what HIA is and how your work connects to health. And it also gives us an opportunity to talk a little bit about a new HIA that we're really excited about, which is the Community Investment Tax Credit HIA, which is just getting going, and I think that will be of a lot of interest to people, and we're going to discuss a little bit more near the end of the webinar.
Great, thanks, Ben. So just to give you all an overview of what we're going to be talking about today, we're going to start us out by getting us on the same page around the question of what is health and what impacts health. Then we're going to talk about an overview of health impact assessments and then talk about the steps to the HIA process. We're going to then give some examples of HIA and then talk about opportunities for community development corporations to get involved. And I do want to mention that all of the slides that we're using today, many of them are adapted from Human Impact Partners, Health Impact Project, and the Georgia Health Policy Center. Okay, so let's get started with the conversation of what is health. So a lot of times when we talk about health, we talk about improving health, and when we talk about improving health, we think about healthcare and healthcare delivery. However, access to healthcare and quality of care only makes up about 10% of the factors that contribute to an individual's health. So this is a really helpful model to see that the real drivers of health are your environment, social and economic factors, and health behaviors. However, even the conversation around health behaviors is pretty limited. For example, you can tell an individual to get more exercise to prevent obesity or diabetes or heart disease. But looking at this picture right here, if this is the environment you live in, and if you have to get physical activity by crossing a street like this, you might be putting yourself in harm's way. Similarly, if you live in a neighborhood with a lot of violence and it's unsafe for you to go outside or walk during certain parts of the day or the evening, it might be very difficult to encourage an individual to actually get exercise to promote their health. Similarly, you can tell somebody to eat more fruits and vegetables, eat healthier to prevent disease, but if they live in a community where it's predominantly fast food or processed food and they don't have access to healthy and affordable fruits and fresh fruits and vegetables, it's very difficult and we're not setting them up to succeed. So we do need to be thinking about, beyond just behavior change, we need to be thinking about the environment. But even when we think about the environment, even though we're not necessarily always thinking about health in decisions that are made, it does impact health. So for example, if you look at local, state, and national policies, such as highway policies or education policies, you will see that there are impacts on health, even though they're not directly related to, or they're not intended to be directly related to health. So for example, if you look at highway policies, they might reduce travel time and maybe even promote better mental health. However, there could be unintended consequences, such as increased time in driving in traffic. There could be a lack of physical activity, an increase in air pollution and traffic injuries, and things like that. Similarly with education policy has led to disproportionately poor education among low-income and minority communities, and it can also impact opportunities for jobs and income, as well as life expectancy. So it's important that we're thinking about how the environment and policies that we make that impact the environment can also impact health. But that's not to say that all policies have unintended negative consequences. They can also have unintended health benefits as well. So for example, in the 1996 Olympic Games in Atlanta, Georgia, they expanded public transportation in order to accommodate the crowds of people coming in to watch the Olympics. And as a result, there was a reduction of auto travel and congestion. And there was also, in terms of direct health benefits, there was a decrease in acute childhood asthma events. Similarly, when the EZ Pass was introduced in the northeastern part of the United States, there was a reduction in traffic congestion, reduction in motor vehicle emissions, and a reduction in health disparities, which resulted in a reduction in low birth weight infants in surrounding neighborhoods. So both of these policies were not intended to be health-related, but they in fact did have health impact. So in order to address the rising rates of chronic disease and create safe and thriving communities, it's important to intentionally look at issues of health in sectors that do not traditionally look at health outcomes. But as I've alluded to, the problem is that many of our daily decisions made outside of the health sector have significant health implications that go unrecognized because health is just not on the radar screens of decision makers. It's not the priority. And so health impact assessments are a way to get health on the radar screens of decision makers and integrate discussions around the built environment, community development, and health. So as Ben mentioned, community development corporations and entities that are involved in community development are a target for this particular webinar because they're really poised to promote health in a comprehensive and holistic way. Community development corporations are unique in that they are engaged in many of the activities that touch the broader levels of impact, including healthy housing, lead abatement, indoor air quality, social cohesion, and community safety. And this quote from a community development corporation in Oakland, California, sums up what a healthy neighborhood is nicely. and demonstrates the impact that CDCs can have in health promotion. And it says, a neighborhood with housing options, quality schools, thriving businesses, reliable public transit, and markets full of fresh food. It's where parents have access to good jobs, children have parks to play in, and grandparents can age in place. It's where we look out for each other and know we are safe, and most importantly, healthy neighborhoods provide access to the resources we need to lead stable, fulfilling lives. And that is a beautiful vision, and we want to see that in all the neighborhoods across the country. And so right now I'm going to pass it to Allyson to talk about health impact assessments specifically and what they are. But before we do that, we want to get a sense from our audience whether you've participated in HIA before. So I'm posting another poll question, if you wouldn't mind answering this, so we have a sense of the background you all have in HIA. So I'll just give it a couple more seconds for people to vote. Excellent, thank you. So let's see what the results are. So you'll see here that about 91% of you all have not participated in HIA and 9% have. And so this is great because we really want to be able to introduce this as a great tool to put into your toolbox. So now I'm going to pass it over to Allyson.
Great. So now that we have a little bit of context about what we mean by health and health broadly, I'm just going to jump into the process of health impact assessment. Can you go back one slide? Great. So what is an HIA? Hopefully that's what you're here about today to learn. So as Brittany just discussed, projects and plans and policies have intended and unintended positive and negative health impacts. And so the idea of a health impact assessment is that it's a process that tries to predict the anticipated and unanticipated health outcomes of a decision, project, policy, or plan. It then takes and translates that information into recommendations for well-informed decisions. So one of the benefits of HIA is that it helps folks outside of the health field understand the direct health impacts of their work. So it tries to make the connections between the project or plan or policy and the health impacts. So here's a formal definition from the field of HIA. It's a systematic process that uses an array of data sources and analytic methods and considers input from stakeholders to determine the potential effects of a proposed policy, plan, program, or project on the health of a population, and also considers the distribution of those effects within the population. HIA provides recommendations on monitoring and managing those effects. So that's just a formal definition that's sort of used by HIA practitioners around the country. Another way to look at it is how might a proposed policy, plan, or project affect health determinants, so those things listed in the middle of the slide, and other things listed or not listed, and how do those determinants then lead to health outcomes? So the idea of an HIA is to identify and measure these connections between the project, plan, or policy and those determinants of health, and then identify and measure how these determinants of health will then lead to predicted health outcomes. So these are just a couple of core competencies or sort of values that are core to the health impact assessment process. HIA is inherently multidisciplinary and so often pulls together organizational partners across sectors. But it's also important to engage populations that will be affected by the proposed policy, plan, or project. And stakeholder engagement is sort of a thread that you'll see us, or you'll hear us weave throughout steps of the HIA as we move forward with this presentation. Equity is also another core competency and a value of the HIA process. And we incorporate equity both by engaging affected populations in the process, but also by measuring the differential impacts of the policy, plan, or project on vulnerable groups, and then making recommendations to improve the proposed decision for these vulnerable groups. And then communications and evaluation. So communications is just sort of a core competency in that there are different groups involved in the health impact assessment process, a project team or an advisory committee, as well as stakeholders. And so it's important to communicate with those different entities throughout the process. And then evaluation, which is also sort of a key part of the HIA process. And it's important to consider process impact and outcome evaluation. So what is an HIA and what is it not? Sometimes there's confusion over what HIA really is and at what stage of the decision-making process it's applied. And the way I typically describe that is HIA is not used to make the case for why a policy, program, or project should be proposed. It's not an advocacy tool. It's also not an assessment that's done to understand the impact of a program or a policy or a plan once it's been implemented. Really, the sweet spot of an HIA is that it's proactive. It's meant to inform a proposed policy, program, project, or plan currently under active consideration by a decision-making body or soon to be considered by a decision-making body. So some people also ask how it relates to different kinds of community assessments that are out there, such as community health assessment or risk assessment. And a health impact assessment is very different from these kinds of assessments. Those are meant to gather baseline data for sort of existing conditions in the community. And what the HIA does is takes that information and translates it into knowledge and uses it to inform the decision-making process. So here's just a brief overview of the HIA process. There are 6 steps to it. You can see screening, scoping, assessment, recommendations, reporting, and monitoring and evaluation. So with screening, this really establishes the need for and the value of conducting an HIA. Is it feasible? Can you do an HIA within the time frame of the decisions? Is there funding for the HIA? And a variety of other questions that should be asked. And there are many factors to consider when determining whether to conduct an HIA. And this step is really key in determining whether you should go forward with what is a time-consuming and resource-intensive process. The second step is scoping, which helps you identify the affected populations and narrows the scope of health effects that you will evaluate to those of the greatest potential importance. Also during this stage, you'll develop a list of research questions and start to identify data and methods that will help you answer those questions. During the assessment phase that really follows the scoping, it describes the baseline health conditions of the affected population and characterizes the expected health effects of the proposal, the policy, the plan, the project, as well as alternatives under consideration. This is really the stage where data and indicators from the risk assessment field or the community health assessment field come into play. And HIA helps to translate that data into information that can be used by decision makers to inform healthier policies, plans, and projects. Once you've done the assessment and you really have an idea of what are those predicted health outcomes, you can make a set of recommendations where you propose alternatives that might mitigate any anticipated negative consequences and maximize the benefits or the potential healthy aspects of the policy, plan, or project. It's important to ensure that your recommendations are practical and match the political and other realities of the situation. Finally, reporting. So that's the actual formal HIA report and plan for communicating findings to the decision maker and the public, as well as other stakeholders that were involved in your process. And then monitoring and evaluation is really the last step and is often forgotten, but is a critical part of the HIA process. And this is really about tracking the results of the HIA, so whether or not the recommendations were adopted by your decision maker, as well as monitoring predicted health outcomes. Great. So what we're going to do is go through the steps of the health impact assessment process in a little bit more detail, and we're going to use this example that was done in Boston in the Dorchester Codman Square neighborhood as an example to sort of show you how a health impact assessment can be applied to a practical project. So Health Resources in Action conducted this health impact assessment last year between April and August in collaboration with the Codman Square Neighborhood Development Corporation. And the Neighborhood Development Corporation there had or was looking to acquire a parcel of land along the Fairmont Indigo commuter rail line. They had a parcel that was about 23,000 square feet, and they were looking at potential designs to include a playground or a tot lot for young children, a teaching and production garden, and a learning and teaching kitchen. So that was the sort of subject for the health impact assessment and what we were trying to look at, you know, ways to make that a healthier design for the neighborhood.
Great. So what we're going to do right now is walk through the steps of HIA a little bit more in depth, and then, as Allyson mentioned, we're going to be using the Oasis on Baloo Codman Square project, HIA project, as kind of a case study for each of these steps. So first, let's talk about screening. So in the screening phase, we really want to identify policies and projects for which HIA will be useful and appropriate, and also determine how much time we have to conduct the HIA before the decision around a policy or program needs to be made. So that's the sweet spot that we're trying to figure out, whether the HIA will be useful and whether we can actually make a difference with it. So at minimum, we want to be able to inform the decision-making process, and this is always going to be conducted in advance of a policy, plan, program, or project decision. And during the screening phase, we'll be asking questions like, what is the proposed project the HIA will address, and at what point would the decision-making process allow for input from the HIA? And this can be tricky to determine. For example, legislation on funding requirements for casino development, that's a decision that legislators would vote on. However, determining the timeline for this in advance can still be difficult, as you will need to determine when the legislation will be introduced and during which session. Also, projects and plans are often produced through a series of decisions, and it's not always clear if and when there will be a decision that would actually benefit from an HIA. Therefore, screening considers what part of the decision-making process the HIA can inform. So we have a series of basic yes or no screening questions, and I'm going to walk through each question and talk a little bit about the Codman Square experience. So the first question is there a decision regarding a policy, plan, or project currently under consideration whose outcomes are likely to impact health? That's the basic question for screening. And so in this case, the Codman Square Neighborhood Development Corporation was determining the design for a parcel of land along a commuter rail line. And as we've talked about, land use and urban planning and the built environment affect health. And so the answer is yes, the outcomes could likely impact health. So here, the next question is, does the decision-making process allow for input from an HIA? So in this case, local residents, called the Friends, were already engaged in the decision-making process of the Codman Square Neighborhood Development Corporation. They were a resident advisory group. And so the Codman Square Neighborhood Development Corporation and the Friends were both willing to participate in the HIA process. And so there was room for input from residents as well as the Community Development Corporation. The next question is health part of the discussion, and would the HIA bring anything new? And in this case, health was not explicitly part of the design for this parcel, but as I hopefully have convinced you already, health does have an impact, the built environment does have an impact on health. And so the next question, can the HIA be completed within the timeline for the decision and with the resources available? And for all those who were involved in this, the timing and funding was incredibly tight. However, we were able to complete the HIA within those constraints. And we were able to anticipate that we could finish it before we started the project. The next question, what is the likelihood that the HIA findings and recommendations will receive consideration by decision makers? So in this case, both Codman Square Neighborhood Development Corporation and the Friends were open to taking its results into consideration. So the answer was highly likely. And then are there other stakeholders who are willing and able to participate in the HIA? And in this case, there were many interested partners around the city and state that really could come around the table, and they were able to form an advisory committee to advise the process of the HIA. Then the question, does this HIA have the potential to increase partnerships, visibility, and support for future HIAs and other health and all policies efforts in your region? And in this case, the HIA brought together new and old partners, and along with other HIAs happening simultaneously, it helped to increase visibility and capacity for the HIA process. And then the final two questions, is there the potential for different subgroups within the community to be more adversely affected than others? So in this case, yes, because there were residents that were surrounding this parcel of land, this could potentially benefit or adversely affect these people. And so we really wanted it to be the design for this parcel of land to be intentionally include the people who could be affected. And then finally, has a group or organization requested the HIA on a particular decision? And in this case, the Codman Square Neighborhood Development Corporation, they had requested the HIA on the design of their site. So I also just want to highlight from these questions the importance of engaging diverse stakeholders in the screening process. Allyson had mentioned that this is a core competency of HIA, and not only can they help identify projects and proposals that might be right for HIA and help determine the decision points where HIA could be useful, they could really help determine the political context and feasibility of a decision and provide on-the-ground information about who would be affected and how. And so that is why stakeholder engagement throughout an HIA is critical. The next step is scoping. And so the purpose of scoping is really to establish the scope of health effects that will be included in the HIA, identify the populations most affected, and the sources of data and the methods to be used. So this is where we create objectives for the HIA and outline steps for the process. We've now said in screening, yes, we can move forward, and so now we need to figure out how, how we can move forward, also given the time frame and resource constraints. This phase helps us determine what health effects this HIA will specifically address, what concerns stakeholders bring around a policy or a program, and who will be impacted by this project and how. And in this stage, diverse stakeholder engagement is also critically important in, this, in order to ensure the voices of all impacted parties are included. And as one proceeds through the scoping phase, it's important that any missing parties that aren't at the table are brought to the table. So there's kind of a constant analysis of who should be here, who's missing, and bringing people to the table to ensure that diverse stakeholders are engaged. Now, some scoping questions. The first one is, why are we doing the HIA? So in the Codman Square example, it was to incorporate health into the design of the Codman Square Neighborhood Development Corporation's parcel, and to also build capacity for conducting HIAs. The next question that you ask in scoping is, how will the decision impact population health? And so this site had the potential to impact social, economic, and the physical environment of the people who use and live near the site. And finally, who will be impacted by the decision? It's the people who use the site, residents who live nearby the site, and the Codman Square Neighborhood Development Corporation and the Friends. Also, who will be involved in conducting the HIA? So we had an HIA team which was made up of people from HRIA, our organization that's presenting today, along with MDPH, which is where Ben is from. We had an advisory committee, and then the Codman Square Neighborhood Development Corporation and the Friends. And finally, how will we assess the health impact? What is the data we can use, and how will we figure out how this parcel of land and its development will impact health? So we developed pathway diagrams, which I'm going to show in just a moment, which show the links between the project and the identified determinants of health and health outcomes. And then we look at the research questions. We determined or decided upon research questions to frame the assessment. The specific research question was, how will the site impact levels of mental health, such as depression and anxiety? And finally, the methods were primary data collection from resident surveys, secondary data collection from existing sources, and also literature review. And here you'll see the pathway diagram for the Codman Square HIA, where you can see on the very left is the parcel of land development for the garden, the teaching and production garden. You look at the immediate impacts upon health, the intermediate impacts upon health, and the ultimate health outcome. And so this is the process that you would go through in every scoping session for an HIA.
Great. So now that we've identified the health impacts, or the health determinants that we're going to look at, the assessment really tries to measure the level and the change of those impacts, and then make some predictions about the magnitude, the likelihood, and the distribution of potential impacts on human health. So there are a couple of different components to the assessment, describing the baseline health status. So we want to know, what are the current conditions in the neighborhood or in the population. We want to use those to then assess potential impacts and then assess the strength of evidence. So as Brittany mentioned, there are a couple of ways that we use the assessment. So several of the methods were a secondary data analysis, so summary statistics available on neighborhood demographic characteristics, health behaviors, and health outcomes related to the health areas of interest. We conducted a resident survey, so it's an 18-question survey to assess local residents' current behaviors, perceptions, and values. And then also, just a key part of any health impact assessment in the assessment phase, a literature review to examine the peer-reviewed and grade literature for the different site components and the overall site. So this is just what you see on the screen in front of you is a little snapshot of the assessment table from the Codman Square Health Impact Assessment. So you see the health determinants, a couple of them that we were looking at. Look at the direction of the impact, so physical activity positively impacts health, as does healthy food access, and exposure to soil toxins negatively impacts health. Then based on all the evidence we have in the assessment, so from those couple of sources, secondary as well as primary and literature, we want to assess whether this health impact is likely, possible, or unlikely. And then we want to look at the distribution of the impact. So who's likely to be impacted by the physical activity impacts of this site? So probably people who use the site or the participants. In the case of healthy food access, it's not only the participants, but this site aims to sell the produce, the fruits and vegetables that we've grown in the garden to neighbors and people in the neighborhood. So the distribution of impacts would be a little bit wider than just people who use the site. And then with exposure to soil toxins, you see people who use the site, especially children. They're a bit more vulnerable to some of the contaminants they might come into contact with. And then the last thing you want to consider in the assessment is the strength of evidence. So in all these cases, there was strong evidence making the links between the project and these determinants, and then the determinants and the health outcomes. So you can see the strength of evidence was high for all of these. So I'm going to turn it over to Ben to talk about two data sources that are local to Massachusetts that would be great to incorporate and use in the health impact assessment process.
Great, thanks, Allison. So I'm aware that many of you might be listening to this and thinking to yourself that it sounds really difficult to do the assessment phase of the HIA, and that's certainly something that we hear from people when we talk about HIA and trying to get them to incorporate them into their practice. And while that can be true, there are a couple of really great resources that we wanted to highlight that we think can mitigate some of those concerns. The first is this new website that is actually going live tomorrow. It's ourhealthymass.org. Again, it's officially going live tomorrow, June 21st, and it's going to continue to be built out over time, but it's designed to assist the user to understand how multiple community-level issues, such as issues around the built environment and crime and safety and local economic issues and those sorts of things, interact to impact health behaviors and ultimately impact health outcomes. And the other one we wanted to point out to you is the Massachusetts Environmental Health Tracking Portal, which is it's an MDPH data portal that is coordinated and supported by our Bureau of Environmental Health, and it focuses in on looking at environmental data such as air and water quality, and tries to link those types of issues, again, with health outcomes, and in many cases does that with local data so you can contextualize and figure out what's going on actually in your community. And the example screenshot that we have up there, I know it's quite small, but we put that up there because it is a example of the type of information that you can get through the Environmental Public Health Tracking Portal, which is pediatric asthma prevalence, and you get that for your local community. And we put that up there because it's asthma and pediatric asthma specifically is a health indicator that we think connects really strongly to the work of community development corporations. So just a brief note to go check those out. You might want to wait a day to check out ourhealthymass.org, but peruse those sites, and you can start to learn how you can look at your own community and start playing around with different data sources. That would be really helpful for this type of a process.
Great, thanks, Ben. And just to note, we actually use the Environmental Public Health Tracking website in the assessment phase of the Codman Square HIA, and that was an invaluable resource to try to predict some of those health outcomes, childhood asthma, lead exposure, and a couple of other ones around air pollution. So great. So after the assessment phase is done, we jump into recommendations. So based on our predicted health impacts, how can we suggest alternatives that could be implemented to improve health, or actions that could be taken to manage the negative health effects? So the minimum element for this is identifying appropriate recommendations, mitigations, and/or design alternatives to protect and promote health. So here's, again, a snapshot of the recommendation table from the Codman Square HIA, specifically related to, again, the teaching and production gardens. So the whole set of recommendations from this HIA were presented to the Health Impact Assessment Advisory Committee, which Brittany mentioned before, which is a group of public health experts who are familiar with the issues in the neighborhood, and they provided feedback on the following. So were the draft recommendations accurate and appropriate with regards to the public health field, and this project in particular? And then were there any other recommendations or resources that should be offered based on the advisory committee's knowledge or experience? And these are pretty typical questions in the recommendation phase. You want to get some perspective from folks who are content experts outside of the project team. But the other way that we got feedback on the recommendations was through the Friends group. And so after meeting with the advisory committee, HRA convened again with the Friends to give them the final word regarding the recommendations. And so they were asked to give feedback on the following. Were the recommendations realistic in the context of the neighborhood? Were the recommendations feasible for the Neighborhood Development Corporation and the Friends? Those are the folks who have to implement the recommendations. Were the Friends' concerns addressed? And then, would collaborating with other groups for the use of the site enhance or crowd out the residents? That was a specific recommendation that they had questioned. So really the Friends, this is illustrating how important it is for stakeholder engagement, because they are really the ones on the ground who are going to use the site, and they're the ones who have to implement the recommendations. So it's important that their concerns are heard and they have sort of the last word about what the recommendations are moving forward. And then the second to last step is reporting. And this is about presenting the findings and the recommendations to decision makers and stakeholders. The minimum elements of this are including transparent, publicly accessible documentation of the process, methods, findings, sponsors, funding sources, participants, and their respective roles. And all of this sort of ends up in some type of report or different documentation. And again, stakeholders can be involved in the framing of the reporting, in the messaging, and also appropriate types of communication. Would it be better communicated through a policy brief to decision makers if it's a policy health impact assessment? Would it be better presented in some type of formal presentation with a PowerPoint? It just depends, but your stakeholders can give you a better sense of what's the appropriate way to report on your findings. So here's just the cover of the health impact assessment that was done with the Common Square Neighborhood Development Corporation, just to get a sense. It was more of a formal report, as well as a shorter executive summary, and that was felt to be the best way to present this to the decision makers. The report was also provided to the Division of Prevention and Wellness at the Department of Public Health for the state. I didn't mention before, but they were the ones who funded this project. Also presented to the Metropolitan Area Planning Council as part of the grant requirements for this process, and also because those folks were involved on our advisory committee. Other forms of dissemination included a presentation at the Department of Public Health Ounce of Prevention Conference and an upcoming presentation at the American Public Health Association annual meeting. So those are just a few ways that health impact assessments can be reported on and communicated.
Okay, and last but not least is the monitoring and evaluation phase of the health impact assessment. So this is often, as Allyson mentioned, the phase that gets left out of HIAs, often due to lack of time and resources, but it is critically important. And this is the phase, the stage where you ask, did the policy pass? Did the program go forward? And what really happened? Did something not happen that we thought would happen? Did we miss something entirely? And this is really where we try to evaluate, moving forward, the impact of HIAs. So looking at how we monitored the Codman Square HIA, it asked, how did this HIA influence the decision-making of the Codman Square Neighborhood Development Corporation? What aspects of the recommendations were included into the proposal to the City of Boston for the procurement of the land and development of Oasis on the Lou? And then there's the evaluation. There's both the process and the outcome evaluation. And in the process evaluation, we included questions like, what resources were used by HRA and Codman Square Neighborhood Development Corporation to complete this HIA? And to what extent was the community involved and engaged in this HIA process? Again, really wanting to have the lens of broad stakeholder engagement. What were the successes and challenges of this HIA process? And did Codman Square Neighborhood Development Corporation find the HIA process valuable? And in terms of the outcomes, we're looking at how many residents utilized the site, have gardening and cooking skills and knowledge changed in the neighborhood, has fruit and vegetable and healthy food access changed in the neighborhood. So these are some of the questions that we can help figure out, was it a success or was it not? And are we positively impacting health, or are we, or did we not? And again, stakeholder engagement is critically important in that they are they are often the people who are impacted directly by the development, and so they can help us determine whether or not they have, the impacts have been positive or negative. And the partners who are regularly collecting the data is the Boston Public Health Commission and the Metropolitan Area Planning Council.
So just a couple other examples of health impact assessments to apply the process you can see. So in San Francisco, they did a health impact assessment of a proposed senior housing facility located next to two busy freeways and looked at a variety of impacts, including air quality, noise, safety, and retail access. They ended up making several actionable recommendations, such as noise insulating windows, moving the building entrance to the non-freeway side to cut down on pedestrian injuries, and several others. But one of the interesting and key findings here is that even though the building's air filtration system met all the permitting requirements, the air intake vent, the way it was written into the plans, would have pulled exhaust from the freeway and pumped it into the building, leading to harmful indoor air quality for residents who, as seniors, are already at high risk for respiratory illness. So this is a relatively easy fix that was recommended and was actually implemented, which involved relocating the intake vent to the other side of the building and upgrading the building's air filtration system. So this is a good example of why it's still useful to do health impact assessments, even though air quality regulations are already in effect. Those regulations don't always take into account the potentially harmful effects that surrounding air quality can have on people. They might look at, what's the indoor air quality, but don't take into account the broader environment. So Ben is going to briefly talk about a health impact assessment that's currently happening in Roxbury in Boston.
Great, thanks. So this is just another example, and it is, as Allyson said, a project that is currently underway. And this HIA is informing 3 community development-led corporation development projects in Roxbury. And the HIA has a bigger picture goal of informing something called the Healthy Neighborhood Equity Fund, which is a soon-to-be-released funding mechanism that intends to incorporate health metrics into its operational structure. And I'm not going to get into details about that. It's too detailed for this. Would be too detailed for this webinar, but people can definitely reach out to me if they have questions about it. I'm offering up this slide basically just as a further example of how health impact assessment links some common activities of a community development corporation with health. So, as you can see in this pathway diagram, the new development, in this case, these are transit-oriented development projects in Roxbury, impact health through a series of immediate and intermediate steps. Next slide, Allyson. And this is just, I'm really briefly, these are just another couple of examples of HAs that have been completed and a couple that are, again, underway right now. The first 2 that have more detail up there for you are good examples of HAs that were done that I think connect well, again, to work that community development corporations and like organizations do in our state. These were the first 2 HAs that were considered completed in Massachusetts. And both of them looked at the effect of various policy changes on children's health. One was looking at, back in around 2004, so changes in eligibility to the Massachusetts Rental Voucher Program, and the other was looking at proposed cuts to the Low-Income Home Energy Assistance Program, again, on how those policy changes would impact children's health. A couple of other examples. We did 2 other HAs last year in partnership with the Metropolitan Area Planning Council. One is the speed limit HA, which looked at a piece of proposed legislation that would reduce speeds on local roads all across the Commonwealth. And another was the Quequechan River Rail Trail HA, which looked at expanding the rail trail in the city of Fall River. And we have 2 HAs underway with partners in Fitchburg and Worcester, both of which have active participation from local community development corporations in those communities. And again, I'd be very happy to talk with anybody who wants to know more detail about those specific projects. And then just finally, wanted to let people know, if they weren't aware, that the Grounding McGrath HIA was recently completed. This was an HIA that was done by our Bureau of Environmental Health at the Department of Public Health, and is the pilot HIA that was done to look at how to incorporate HIA routinely into transportation planning processes statewide. So we're really excited that got completed, and look forward to seeing how it ultimately does help us move towards institutionalizing this practice in transportation planning.
So we just wanted to give you a couple examples to see how the HIA process is applied. And hopefully through these, you've seen some of the benefits or heard some of the benefits of the HIA process. It involves a broad range of impacted people and can be used as a tool for community capacity building, was really illustrated in the case of the Cozzens Square HIA. And it gives communities a structured way to engage with decision makers where their voice hasn't previously been at the table. It's also an effective tool for meaningful cross-sector collaboration like we've talked about. And the relationships and the trust that's built through this process increase the likelihood of routine consideration of health by sectors that don't necessarily normally routinely consider health. But there's also a strong business case for HIA. Business and industry have actually been early adopters. And the World Bank and IFC have made HIA part of their standards for evaluating loan requests for large development projects. And large multinational corporations like Shell and Chevron are increasingly implementing their own standards for HIA in planning new projects. From an industry's perspective, it helps them be more socially responsible corporate citizens by proactively addressing community concerns when something can still be done about it without exorbitant costs. It can actually help speed approval and lower business costs. We've even seen examples of HIA helping to avoid litigation in projects. And it also helps them know their health return on investment used as a form of risk management. So now that we've given you a little bit about the HIA process and some examples, Ben's going to talk a bit about who does HIA and sort of give the national context for the health impact assessment process.
Great. And I'm going to go quick through this so we have a few minutes at the end if people have questions. And really the take-home message from this slide is that even though in Massachusetts we've seen governmental organizations be the ones either supporting or doing HIA or funding HIA to a large extent, that's not necessarily the case throughout the country, and I think there's more examples upcoming in our state of how other types of funding opportunities exist to support HIA and different types of organizations that are embracing this practice. Oftentimes HIA arises from very local community concerns, and so local nonprofit organizations or community organizations are the ones who are really pushing it. And often it's done in partnership because there's different levels of expertise and capacity to do this type of research. Certainly partnering with academic organizations or nonprofit research-based organizations is a useful thing to do if you can identify those organizations. But the take-home message really is that HIA is done by a variety of different organizations. Next slide. And so there's a diversity in the types of practitioners. There's a real diversity in the topics and sectors to which HIA is applied. As you can see, historically anyway, the built environment transportation has taken up a really big piece of the pie in terms of the types of topics that HIA focuses on. But you can see economic policy, education policy, climate change to a certain extent, energy and natural resources, those sorts of issues are areas that HIA has been applied. And I will say that I think that the piece of the pie that the built environment transportation takes up is shrinking as people understand how it's better to apply HIA across a variety of different topics. Next slide. And this just shows you a little bit about how far and wide the practice of HIA has spread. You can see that there's a lot of activity that has happened on the Pacific Coast, but really it's something that has been embraced by most areas of the country, even though you do see a lot of blanks in there. This is a map that, if you looked at it, I think it's probably maybe just a little bit older, maybe a year old. If you looked at the most recent map, you'd see that there is a lot more HIA activity going. The take-home message here is that it's a practice that's really exploding. And this slide is just meant to drive home the point that, as Allyson and Brittany were talking about, screening being a really important phase. It's really it's obviously important because you need to do a good job in screening to know whether or not you should be expending the resources that you need to expend to do HIA, and that HIA really is not for every decision. You really need to focus in on when health is not an aspect of the decision-making process, and that decision-making process being one that you think does have the potential really to impact health. HIA is meant really to be just one of many tools in our toolbox. All right, and so finally this takes us to the last couple of slides and gives us an opportunity to talk about our newest HIA project, which is just getting off the ground. This is the Community Investment Tax Credit Program, HIA. So as this audience is well aware, the CITC program has the potential to provide significant new resources for community development corporations in the Commonwealth. And through a deliberate screening process, we came to the conclusion that there's an important opportunity to use the implementation of the Community Investment Tax Credit Program as a way to really dive into the connection between community development and community health. And so the short version of what the project is going to focus on is to inform our state's Department of Housing and Community Development's process as it defines how the CITC will operate. But the bigger picture is that we're trying to help all the different parties involved with implementing the CITC. So that's entities like the Department of Housing and Community Development, it's local community development corporations, it's support organizations such as the MACDC, and importantly, it's funders, people who are going to provide funding to and donations to local community development corporations. So how all those different parties can better understand how community development impacts community. And an important goal of this new HIA is to identify health metrics that can be measured over time, helping the CITC program evaluate health impacts over the life of the program. And here, finally, this is our last slide. Just wanted to, for anybody who's actually listening to this who is a community development corporation or is involved with local community development work in Massachusetts, we want to let you know that we're holding 3 scoping sessions in different parts of the state. You can see the dates and times there. And these scoping sessions are our opportunity to reach out to people who actually do community development locally in the Commonwealth, get your thoughts and opinions and perspective on how your work interacts with community health so that we can really define what our assessment and research program is going to be for this HIA. So please, if you are one of those entities, please be on the lookout and participate if you can. Thank you.
Thank you, Ben. And now, just to close this out, we have one more poll question that we'd like to ask, and it's related to this last slide. And it's whether you are interested in participating in the CITC HIA. So if you would all take a moment and just answer yes or no, we would like to know who would be interested so we could follow up with you and give you further information about how you can be involved. Just give everyone a couple more seconds to fill out the question, or to answer the question rather. Okay, excellent. Oh, there's a few more coming. And right after this, after we close the polls, we're going to be opening it up for questions. So if you have any questions, you can feel free to write it into the question box or to raise your hand. All right, thank you so much. So now we are going to open it up for questions. So, and I can unmute the lines if anybody has a question that they would like to ask. But you just need to raise your hand first.
I have a quick question for Ben. Ben, what's the timeline for the CITC HIA?
So we are, it's as these things often are, very abbreviated time frame, but we are trying to influence and impact the decisions that the Department of Housing and Community Development is making, and they are on a timeline of getting out the applications for community development corporations sometime in early fall, or at least by mid-fall, and so RHA has to be done in time to inform that decision-making process. So a lot of work is going to be happening over the summer and early fall.
Great, thanks.
Okay. We'll give you just another minute to see if there are any other questions.
Okay, so if there are no more questions, just wanted to let you know that these slides will be available for all participants on the call.
So thank you so much. We're right at the end of time. So thank you so much for participating in our webinar today, and have a wonderful day, everyone.